Good afternoon, everyone, and welcome to today's webinar, The Essential Elements of Financial Viability, which I'm really excited because this is a webinar that will share recent highlights of a finance survey that was done among open greenhouse adopters. This is Susan Ryan, and I am the Senior Director of the Greenhouse Project. Before I introduce today's speaker, I have a few housekeeping details and future opportunities to share. I want to remind you that you're in listen-only mode, but you are able to share questions or comments through the chat box that's on the right-hand side of the screen. And the presentation will be available for download at the end of the presentation. Additionally, the session is recorded, and you will get a link as well as the presentation sent out to you in the next few days. So let's get started into our webinar today. I want to introduce Terri Metzger. Terri has been a friend of Greenhouse, certainly ever since I've been a part of the project for the last 10 years, but even prior to that. Terri has over 20 years experience in the senior housing and care industry. Currently, she provides consulting services to organizations involved with the development, operation, or oversight of senior living facilities. Services performed include strategic and business planning, market and financial feasibility studies, the development of tools for state agencies and project sponsors or operators, assistance in the implementation of long-term care services and supports, policy and procedure manual development, and operational consulting. And we have certainly tapped into all of those areas of Terri's expertise. I think what I've most appreciated about working with Terri over the years is her, first of all, this financial feasibility model that she has developed for Greenhouse has incorporated all of our lessons learned around staffing. She has been one to really interact with our adopters to understand what's working well, and most recently kind of went to do a finance survey among open greenhouse adopters to really learn a little bit more about their development costs, their operating costs, what the payer mix was looking like. And so it really was a culmination of the work that she's done with us for greater than 10 years now, as well as what we have discovered on the finance survey. And really excited to turn it over to Terri. Thanks, Terri.
Thanks, Susan. So Susan said today we're going to be looking at the essential elements of financial viability, particularly as it pertains to greenhouse projects. And with this, we're going to first start by looking at industry trends and how the greenhouse project can impact or address those industry trends, which include occupancy and payer mix trends, staffing trends, and the aging of physical plants within the skilled nursing facility industry. Then we're going to move from that into looking at what the key elements of financial viability are and how projects are able to achieve financial viability through implementation of the greenhouse model of care. And finally, at the end, we'll have time for questions and answers. So feel free, if you have questions as we move along, to send those questions in, and we'll try and capture those at the end of the presentation. So I'd like to start by having kind of a big picture view of the skilled nursing industry today. This is results of a survey that was done by Lancaster Pollard earlier this year from senior housing and care providers, looking at what the 3-year economic viability outlook is for standalone skilled nursing facilities. And as you can see from this graph, only just slightly more than 20% of all of the respondents felt that that outlook was good, with about 40% reporting a poor outlook and approximately 40% reporting a fair outlook. So pretty pessimistic viewpoint of the skilled nursing industry at this point in time. What is it that's impacting on such a negative viewpoint of the industry? And that's where we get into the trends. So the first trend that we'll look at has to do with occupancy and payer mix. Looking at this graph that was provided by Nick, this goes from 2011 through December of 2017, we see a pretty steady decline in overall occupancy of skilled nursing facilities with an all-time low in December of 81.9%. So correlating closely with that is a similar trend for our private pay census, showing a steady decrease from, again, 2011 to December of 2017 with an all-time low for the private pay census of 8.6%. The inverse trend for that would be the increase in Medicaid that's being seen over that same period of time with an all-time high in December of 2017 of 66.2%. So all trends that are having a pretty negative impact overall on the industry at this point in time and appearing for all of those trends to continue in that negative direction. How can greenhouse homes impact in a positive way on those trends in those areas? So what we're seeing with occupancy with greenhouse homes, and this data is as reported by greenhouse adopters and from a recent survey that was conducted with operating projects. So we have the national average here of 81.9%, and we saw previously. This is compared to the greenhouse average as reported through that survey of 97%, and the greenhouse median occupancy of 98%. Pretty stark difference there between the national average and what we're seeing with the greenhouse adopters. The same is true with the private pay census. So we have the national average at only 8.6% versus the greenhouse average at 47.8% and the greenhouse median at 47%. What is it that is allowing greenhouse projects to capture such a higher occupancy level and also a higher private pay census? It really comes down to the fact that the greenhouse model of care is able to provide a more attractive option for consumers, a true consumer-driven model versus the more traditional, oftentimes institutional setting that we see in many skilled nursing facilities. With the greenhouse model of care, you have all private rooms, there are full baths in every room, you have flexible scheduled with really true resident-centered care, and not only just residential environment, but actually a home. So the residents are living in a true home. All of that just provides an environment that is very attractive, very desirable by today's consumers. And this is substantiated by research that shows that 75% of caregivers would drive further if they were able to place their loved one in a greenhouse home. And in addition, 60% of caregivers would be willing to pay more to have their loved one be in a greenhouse home. So we have not only the ability to capture a higher private pay census, but we also are showing the ability to drive your revenue by being able to charge higher private pay rates. And this is shown in data that we have from greenhouse adopters that have chosen to charge more for their greenhouse homes versus their traditional legacy building. And the premium for those adopters is averaging 11% more for their greenhouse homes, again, than for the traditional setting. The maximum premium for adopters that are choosing to charge more for their greenhouse homes over their legacy building is 55%. So it just provides a little bit of a snapshot into what's possible with the increasing your private pay rates with the greenhouse model of care versus a traditional setting. Allows you just to be able to leverage that revenue a little bit more. As far as Medicaid, we're seeing, again, the national average was 66.2%, and greenhouse average is 44.7%, with a median for Medicaid of 49%. This, I think, shows us a couple of things. One is that even though greenhouse adopters are able to capture a higher private pay census, this doesn't mean that the greenhouse model of care is only a high-end model for affluent demographic populations. So most of greenhouse providers are wanting to serve Medicaid, and they are serving Medicaid. We show a minimum, some providers that have 0% Medicaid all the way up to some that have 75% Medicaid. So this range in the Medicaid percentage within greenhouse homes really driven mostly by the mission of the doctor as far as what they are wanting to be able to achieve in their payer mix under ideal circumstances, and also just factors, practical factors that impact on the financial viability of a project. And that's something that we'll be getting into more at the end of the presentation, what some of those factors are. The next trend that we'll look at has to do with Medicare. Research is showing Medicare to be the fastest growing sector in the industry, and that attracting more Medicare residents supports stronger financial performance. In fact, in December of last year, Medicare represented just 12% of patient days, but almost 23% of the revenue mix. So really able to, and that's per NIC, data provided by NIC. And this shows us that, not surprisingly, serving more Medicare residents allows those providers to really maximize their profitability of their facility, and that flows directly into the bottom line. So with greenhouse homes, we're seeing some innovation around short stay rehabilitation care within greenhouse homes. This model of care was designed initially to provide home for life for long-term care residents. But in 2010, the Leonard Florence Center for Living, which is located just outside Boston, really decided that they wanted to pioneer the use of greenhouse homes for short stay care. And they did that in a very, very successful way, proving that rehab care provided in the small home setting can actually provide better outcomes and achieve higher occupancy levels than may be seen in the more traditional rehab setting. And this has come to be called functional rehab, with the therapy being provided in a real home versus a gym, and allowing the focus to be on practical skills. So that's where the functional comes into play, where residents are really able to practice their skills with activities that they will be using once they're discharged, once they're back in their home setting. And this is able to allow the therapist to confirm when residents can safely be discharged home. So all of this functional rehab really has contributed to very, very high outcomes So this is with the Leonard Florence Center for Living Rehab Homes. They have 3 homes with 30 short stay beds. They've achieved an average length of stay of only 14 days. Part of that is because of the desirability of the homes, that they're able to attract a younger, a very motivated population, with approximately 50% of their rehab residents being orthopedic residents. So again, that younger, motivated population able to is part of that contributing factor to their very short length of stay. They also have very high rug rates, with 79% of the residents at the ultra high rate, and that translates into an average daily rate of $600, which puts them in the 90th percentile for all of the facilities in their region. So again, very high outcomes, high occupancy rates, and again, they were the pioneer with this. Since they pioneered this back in 2010, we have other doctors who have followed along this path. One of those is John Knox Village, which is located down in southern Florida. And John Knox Village opened their homes in 2016. They have, of all the homes they opened, 4 short stay homes for a total of 48 rehab beds. They achieve an average daily census of 99% in those short stay homes, with an average daily Medicare rate of $550 per day. The greenhouse model of care has allowed them to become really the provider of choice in their area as far as Medicare goes. And they currently have the largest Medicare census in their county. One of the opportunities that is available to them with their short stay homes is participation in the skilled nursing performance network with one of the major hospitals in their area. And this shows data from all of the participating providers in that network. You can see John Knox Village is right there in the middle in the red. And we have the cost per episode at $9,200 per episode compared to the highest cost provider at just over $18,000. So you can see they're coming in at half of the cost. If we look at the average length of stay, they're pretty much kind of in the middle of the pack there with average length of stay, but their percent readmissions per episode is only 9%, which is a quarter of what we're seeing with some of their competitors. And by far, they are the lowest as far as that percentage of readmissions. So all data that is very, very attractive to partners such as this hospital that they're partnering with in this performance network. So in addition to some of this cost data, we also have reports from John Knox Village of very, very high quality of care outcomes as well. And I'll show you just a couple of samples with this. So this is the percentage of falls, the incidence of falls for the 2 quarters of 2016. And you can see John Knox Village here substantially below any of their competitors for this quality indicator. Another example of this would be with high-risk pressure ulcers. Again, for those 2 quarters in 2016, John Knox Village, much, much less than any of their competitors as far as the incidence of pressure ulcers. So this is showing us that not only can providers who are doing short stay care in greenhouse homes achieve high outcomes related to cost and occupancy, but also related to the quality of care, all which positions those providers very, very well to be able to enter into partnerships with healthcare providers such as hospitals. So again, you have that opportunity because you have minimized cost, you have decreased length of stay, low hospital readmission rates, high quality outcomes, and in addition to all of that, it's a model of care that's highly desirable by consumers. And both of these organizations that have pioneered this, the use of the rehab homes, report just a very, very high consumer satisfaction with their residents and their families, physicians, and the hospital. So across the board, they both report really becoming the provider of choice for rehab care in their market area. All of that, of course, is able to flow down from a financial standpoint to enhance the financial viability of a project. We're going to go next to look at staffing trends, another key impact on the viability of projects because staffing is such a high percentage of operating costs for projects. Staffing is not surprisingly a key concern for many facilities, with 82% of facilities reporting a shortage of workers to be a key concern. And this was again taken from the Lancaster Pollard survey that was done earlier this year. Much of that, the staffing concern, may be derived from the increasing demand for labor. So this graph shows the projected increase in labor between 2014 and 2024, and you can see this just a high percent increase projected for across all of the these care positions: personal care aides, home health aides, nursing assistants, and not only competing against each other for those positions, but also you can see the wages for the care aides are very similar to those for the food service workers and for the retail industry. So all of those industries having this projected increase in staffing needs and having to compete against that. That demand for staffing is undoubtedly has an impact on the turnover that we're seeing within the skilled nursing industry, reported by the American Healthcare Association to be close to 50% for the direct care staff. So with the cost to replace a position estimated to be up to 25% of the annual salary of that position, this can begin to have a pretty significant negative impact on the financial viability of a project. So how can greenhouse homes be able to address this concern with staffing shortages and staffing turnover? Research has been done that has shown less job stress for greenhouse CNAs as compared to CNAs working in traditional settings in the following areas: in the number of residents assigned, with staff turnover, staff callouts, and finally with the quality of teamwork. And so all of those areas, again, reporting less job stress in the greenhouse setting versus the traditional setting. In addition, greenhouse nurses are also reporting less job stress as it's relating to staff turnover. You have 19% reporting that job stress in a greenhouse setting versus 54% in a traditional setting. And finally, greenhouse CNAs and nurses report high work-life quality with the integrated nursing model of care that is used within the greenhouse model of care. So these kinds of factors can lead to higher job satisfaction, can lead to lower turnover, and that can, of course, lead to more financial viability, flowing through to the bottom line if you have this kind of work setting that is more desirable for your staff. So moving on to the next trend, having to do with the aging of the physical plants within the skilled nursing industry. And we're seeing most of the facilities in the industry were built in the 60s, 70s, and 80s. Those facilities, of course, are now 30 plus years old, have aging physical plants. With those physical plants, also typically very outdated and not able to meet the needs and the expectations of today's consumers very well. So we're seeing a lot of attention to nursing home providers trying to see how can they work with their aging physical plant? How can they reposition their facility in light of the fact of the aging of those buildings? This slide is provided by Ziegler Investment Banking. Their deals between 2014 and 2017, which show that almost 40% of those deals involve the expansion or repositioning of a skilled nursing facility. An additional about 5% we're looking at converting semi-private to private rooms within their skilled nursing facility, and corresponding with that to a decrease in the skilled nursing beds, with a small number actually exiting the skilled nursing industry altogether. So I think this shows the attention that's being put on the aging of the physical plants, how to respond to that in a way that is still able to, to be financially viable with that cost of construction and or renovation. The greenhouse model of care is well positioned to be able to help providers really address the concern of the aging physical plant and still support the financial viability in terms of that cost of development or renovation. Some of the advantages in looking at the greenhouse homes to be able to do that repositioning or to address the aging physical plant issues would be the flexibility that comes with the small home model of care. So with this model of care, you're able to flex with the market. You're not stuck with a building that you need to try to fit with where the market has to fit with you, but you can change with the market. For instance, if you build a certain number of long-term care and rehab homes, and the market changes as you move forward, you can flex with that and have a larger number of rehab homes, say, or a larger number of long-term care homes. Or you could move into serving a niche population that perhaps you hadn't served before, or add another home for a niche population. So you're not, I want to say, stuck with a larger building that provides some inflexibility that are able really to change as the market changes, should that happen down the road. Other advantages with the greenhouse model in being able to look at the repositioning efforts that organizations are doing now would be the high resident and family satisfaction that has been shown to correlate with greenhouse homes. And this has to do with both improved quality of resident life, enhanced quality of care, and also increased family satisfaction. So all of that providing, just high consumer validation for the model of care. Um, and then finally, with increased engagement and quality of care that has also been shown to be substantiated through research with more direct care time in the greenhouse model, increased engagement with elders, and improved care outcomes from the greenhouse model of care. So we've seen some of the trends that are happening in industry today, how the greenhouse model is able to address those trends in a positive way. I'm going to look now to see how we put all of that together. What are the key elements to achieving financial viability, and how might that be possible for a particular organization? As we begin to look at this, the first, I think, thing to recognize is that the definition of financial viability differs between organizations. And we really see this as we work with organizations that are looking to implement this model of care. And so it's very important to understand for an organization to really be clear, have clarity around what their expectations are for financial viability, what their needs are for financial viability, and then we can work with the critical variables to be able to meet the needs of that particular organization. And when I say that, kind of to give an example of how that definition may vary. So we have some organizations that are very focused on the bottom line, and they're defining financial viability absolutely with some just financially driven definitions of viability. Some organizations, on the other hand, have used the greenhouse homes to help to reposition their entire campus. And financial viability is less important to them because they are using it for this higher, I want to say kind of higher purpose of repositioning and drawing a new potentially population even to their campus. Some organizations are very focused on serving a high Medicaid population because that's the mission of their organization. And so financial viability may be defined differently than it would be for another organization. So those are just some examples of what I mean by looking at the definition of financial viability and what the needs are for a particular organization. So within the financial viability equation, what are those key elements? And first of all, we look at revenue, which can impact significantly on the bottom line and the area in which the greenhouse model of care can really have the biggest impact. So with a long-term care payer mix, we've talked about the ability of the greenhouse model to impact on the private pay census. So you can attract more private pay residents typically with greenhouse model than you can with a traditional facility. Obviously, attracting more private pay residents allows you to increase your revenue because typically private pay is a higher payer than would be Medicaid. So the private pay rates, also there's opportunity to leverage that revenue in terms of increasing the rates that can be charged for private pay residents. And some of that is market driven in that you're going to have some geographic areas are going to be higher cost areas, or maybe more affluent than other areas, and may be able to demand higher rates. Some of that is also mission and then organizational driven. As I said before, some organizations don't want to be at the high end of their market. They want to serve perhaps a more moderate population. So all of that can impact on the private pay rates that are charged by greenhouse home providers. We're seeing from the finance survey that we recently conducted, the range in private pay rates from $246 per day all the way up to $415 per day. So clearly that's a big difference. And depending on the geographic region and the cost structure, again, um, that being able to charge those higher rates is one way to enhance your revenue and then have that flow through to the bottom line. So the third aspect here, the impact or element of key of financial viability will be with the Medicaid rates. Medicaid rates are obviously state-based, and unless they're acuity-based as well, typically providers don't have a lot of leeway with what their Medicaid rate is going to be. We're seeing rates all the way from $189 per day all the way up to $265 per day. So the amount of that Medicaid pays for care in a state may impact on obviously on the amount of Medicaid, the census that an organization is able to accept as far as Medicaid residents versus private pay, and depending upon and then also obviously on the overall financial viability of the project. So all of those factors, with the long-term care payer mix and rate structures can impact very significantly on the bottom line for a project. The other revenue related or payer mix related key element would be with the short stay rehab homes, which we talked about earlier as far as the ability of those homes to enhance financial feasibility. Because those homes tend to be more profitable than the long-term care homes. Part of the beauty of the model, again, is with the flexibility. So providers are able to test the use of greenhouse homes for the short stay care, perhaps by just building one rehab home. Or if the market can support it, to be able to do as John Knox Village did and build almost 50 rehab beds in the greenhouse home setting. So again, that flexibility with being able to, should you choose to incorporate short stay homes within your overall greenhouse project, and this can again provide some financial viability and be a key factor in being able to enhance the bottom line for a project. Operating costs is another, of course, big variable with financial viability of projects. We find that the costs range based on the provider. So we see some higher cost providers. Those may be located in higher cost areas, but not always. We see just some providers have a more streamlined and efficient operating model than others. But the key thing here is that whatever the set point is for operating costs for a provider, the costs for the greenhouse model of care tend to be comparable to those found in traditional facilities. So that allows organizations to be able to budget for the greenhouse model of care based on their historical performance. Again, have the ability here to enhance revenue, sometimes very significantly. Operating costs are staying very much the same typically. So all of that, again, flowing through to the bottom line for projects. So the development costs and the funding of those costs will be the final elements that we look at. With development costs, we see a big range in construction costs. Oftentimes, this is based on just the geographic location. So for instance, here we're seeing a range from our recent survey of $263 per square foot all the way up to $521 per square foot. So a big difference there. Sometimes there isn't a lot that organizations are able to do to really address the construction costs unless they have, we actually have one adopter that has has a partner who is a contractor and is able to really draw on that relationship to be able to minimize what the construction costs are for their greenhouse projects. But in lieu of that, one way that you can really work to minimize the development costs is with the square footage, with the design of the homes. So we have homes reporting for 10-bed homes square footage from about 6,000 square feet all the way up to 10,000 square feet per home, which, as you can see, would add approximately 40% more in your development costs, certainly in your construction costs. The median of those homes, of the 10-bed homes, is 6,900. So this definitely can be a way to be able to help to lower development costs. And the greenhouse team is very skilled in being able to work with potential adopters in that design process to be able to design homes that are very efficient, that minimize the square footage, that are also very, very attractive and desirable to consumers. So that's again an advantage of really capturing the experience of adopters that have gone before and being able to build on that experience to have homes that are both attractive, efficient, and are minimizing the costs. The final element that we're going to look at is with the funding of those capital costs. So clearly that's sometimes considered to be a huge barrier for being able to develop a new construction project such as greenhouse homes. Because you need to have either enough new net operating income cash flow coming from a project to be able to cover those costs or raise those funds from some other area. So what we've found from the surveys that we've done is that on average, 71% of greenhouse adopters have used debt to help to fund their capital costs, and with a median of 82% using debt funding. 22% on average have used a capital campaign to contribute to the funding of those capital costs with a median of 9%. 4% other sources of equity other than the capital campaign, and 1% on average have used new market tax credits, which, if you're not familiar with that as a funding vehicle, a new market tax credits can provide up to 20% of the capital costs for a project. So that's determined by the census tract that the project is located in. So you need to be a qualifying census tract. But if that criteria is met, this can open up certainly a good resource to be able to help with the sources of those capital funds. For those projects that have used debt for their capital funding, we're showing approximately 60% of that debt being in the terms of tax-exempt bonds. Another 14% has come in the form of commercial loans, 9% from USDA, and 5% from other types of debt. So this is important because the terms that are available for debt can really make a difference in the viability of a project, to be able to just help to leverage the net operating income from a project by having favorable terms. And we see this with the tax-exempt bonds, where we have typically lower interest rates because of the tax-exempt status, and also with the USDA Community Facilities Program, loans that offer, again, low interest rates. At this point in time, those rates are still running between 3.5% to 4% for the USDA program. So very favorable loan rates, 35 to 40-year terms, and typically very low debt coverage ratio requirements. The key to this program, to the USDA program, is that it's only available in rural communities. But for projects that qualify for this program, it can really help with the viability of the projects. So all of those elements that we've looked at, the different elements related to revenue, to the inclusion of short stay rehabilitation homes in projects, and then with the development costs, and finally with the sources of funding for projects, all come together to be able to determine what can make, how can you work with those different elements to be able to achieve the financial viability that is expected and needed for a particular project. The Greenhouse Model Initiative has developed a financial feasibility tool that is really able to support organizations in being able to evaluate the viability of a greenhouse project for their organization. So this is a very, very comprehensive model, financial model that allows organizations to test a variety of different assumptions and critical elements to really understand what would be needed to achieve that financial viability for their organization. And this tool allows, obviously it's going to be based on the market conditions, but allows you to test really just unlimited numbers of different assumptions and scenarios, kind of playing with those different key elements to see what can work, what would work, and what's going to both meet the needs of the organization and achieve that financial viability. So to find out more about that process and that tool, if that is of interest to you, reach out to the initiative, to the Greenhouse Project, and they can help you with that. Just another note on that: we actually walk with organizations that are interested in testing the financial viability, providing feedback from operating organizations, from operating homes, and just helping to with the analysis of for those individual organizations. So it's a tool provided and also a process that's available to assist organizations in really walking down that road to be able to test assumptions and see what may be viable and achievable for a particular organization. So with that being said, if you have questions that you would like answered at this point in time, go ahead and send those questions in if you haven't done so already, and we'll get to as many as we can during this last Q&A time.
So Terri, there's a question that has popped up about how does staffing change for a short-term Medicare house?
So staffing changes in that with traditional, with the homes for long-term care residents, we have for a 10-bed home staffing pattern of 3-2-1. So 3 on the day shift, 2 on the evening shift, and 1 on the night shift. With the short stay homes, we're adding in some additional shabazz of typically for a 10-bed home, about 4 hours per day. And that position can be utilized whenever the needs of that particular home are the greatest. And then adding in some additional nursing time as well. So the nursing time has been modeled off of what the Leonard Florence Center for Living has done, which is sharing a nurse between a long-term care home and a short stay home. So for 10-bed homes, that works really well. So you're not needing to add nursing care for your everyday needs, but adding in care for high acuity times and or when you're having a lot of admissions. So supplementing or enhancing the level of nursing a little bit. And then we recommend adding a little bit more to some of the support positions that are utilized more with your short stay homes. And that could include admissions, MDS, and some support more from an administrative standpoint with scheduling appointments and just coordinating kind of more of those details around admissions and discharge.
Okay, we've got a question. Have you seen many projects use SBA loans?
I'm sorry, was that SBA?
Yes, I'm assuming Small Business Association.
Right, yeah, Small Business Administration. I have not seen that yet. I don't, and I have not personally looked into that to know if that would be an option or not, but I think that that's a great idea to see if that potentially could be an option for projects.
Great. So you said that 9% were USDA funded. Can you talk a little bit about what was common about those projects? Did they have a lot of high Medicaid? I mean, obviously rural, but what else about those projects could you tell us?
Sure. So obviously, the common denominator with all of those projects is that they're located in a rural community, and the USDA program has, eligibility requirements for the location, which I believe is population of 20,000 or less in the community. So that would be the common denominator for the location of the projects. USDA does not have any requirements for serving low income, so you don't necessarily need to serve, any percentage of Medicaid within those projects. They're just looking to obviously want to make sure that the project, is financially viable moving forward.
So as a private developer and thinking about building a new project, is there a minimum amount of beds that you may consider necessary to make the project viable or feasible?
So that's a great question, and I would say there the I want to say the standard answer would be probably about 60 beds to be able to gain some efficiencies. But that being said, we have a range of size in greenhouse projects, with one project that is reporting very high financial viability with only 2 homes. And then a very, very large project that we're actually going to be highlighting in our next case study webinar that has 16 homes. So, and they also reporting very high financial viability. So we do have a range. I think that the key is being able to tailor your staffing to be able to, if you're looking to do a smaller number of homes, to be able to, so you're having the same proportion of staffing if it's a smaller project versus a larger project. And that's really where traditionally you think of you get economies of scale around staffing. You can get it's possible to have those same economies. You're just going to have staff wearing multiple hats in a very small project. So the long answer to that question is I don't think there is a number that can't work, but the smaller numbers of homes require more creativity in looking particularly at the staffing. And that's something that, with the financial feasibility model that's been developed for the initiative, we actually have a process where we guide potential adopters through a financial feasibility analysis and really not only provide the format to be able to allow providers to test their assumptions and see how it can work for them, but also to provide feedback and guidance about those assumptions. So particularly this is true around staffing. So if a provider is looking to do just a small number of homes, we can provide assistance in being able to know how to tweak the staffing pattern so it can work for a very small project.
And I think most developers that have built recently would concur with your thought about 6 homes of 10 or 12 people each. I think we're seeing that's typically what our developers have determined to do. So here's a clarifying question, I think, Terri. When did recommended staffing change from 2 to 1, and that's 2 Shabbazim on days, 2 on evenings, 1 on nights, to 3 to 1? And I would say, and you can correct me if you meant something differently, 3 to 1, 3 Shabbazim on days, 2 on evenings, 1 on nights, is if you have 12 elders in the home as opposed to 10.
Correct, yes.
All right, next question. The presentation covered construction cost. What about the cost of land per bed?
The cost of land per bed, we did not ask providers as part of our financial survey, but I can tell you from working with many, many potential adopters that the cost of land obviously varies significantly from $100,000 to up to $1 million plus for land, and can obviously impact on the viability of a project. So it's actually a great question, and the selection of a site, if somebody is building on a new site, can be critical. You know, if you're really looking at that site from a standpoint of how can we minimize our site work costs. Even the cost of the site, because greenhouse homes tend to be an attraction, you don't necessarily need to have the street front visibility that you might want to have with other types of senior housing projects. Once your reputation is established, people are tending to find you. So not as important to have very high cost, visible locations if there's a big difference in cost there.
Yeah, that's great. Do you have any recommendations for a framework of capital funding for a tax-exempt, faith-based organization?
I would need more clarification on the question, actually. And that might be something that maybe we could do on an individual basis with the person who submitted that question.
We will reach out and try to have additional conversations. So is the financial viability tool available to us? We've just starting to draft a business case. And I can tell you if you're, yeah, sure. If you're interested in working with us and the financial feasibility model, that is available, and we will certainly reach out to you, and we will make some information available about how to get involved in utilizing the financial feasibility tool. On the payer mix side, it has a predominantly Medicaid facility in his payer mix. He built a greenhouse, and does he see the private pay mix go up dramatically? Intent behind the question is, do providers with high private pay census already build greenhouses, and the private pay follows the already established reputation?
I think that there is definitely some of that, where some of the providers that are developing greenhouse homes already are market leaders and are already able to capture a high private pay percentage. And we also have homes that are either new developments or are basically repositioning within the marketplace. So I think that you have both there. Both are a factor.
And I just to add to that, I think it's important to note that, in fact, the case study that you'll be featuring in July, I remember when they were developing their pro forma, they had anticipated, I want to say it was about a 65% Medicaid projection, and the rest private pay. But in actuality, they were consistently better than budget and having anywhere from a 50 to 55% Medicaid and the rest private. So, and again, research would support that, and we are seeing with our percentage of private pay, that typically the private pay payer mix does go up once greenhouse homes are there compared to what it had been.
Yeah, absolutely.
Okay. What is your definition of financial viability, Terri?
I would say I'm going to go back to saying that it depends on the organization. And with some organizations, they're looking at key factors such as a percent margin. Other organizations, they're looking at greenhouse homes really as a way to position an entire campus within a community and position them as a market leader and innovator. And so the actual bottom line for their homes is less important, because that's not what's driving their their development of the homes at all. So it depends, and that's when we work with projects on the financial feasibility analysis process, that's really the first question that we ask is what are your expectations? What are you looking to achieve with the development of your homes? And then the financial feasibility process is a process of helping that organization to get there by working with all those critical elements that we discussed.
Great. So in an area where land costs are extremely high, is a stacked model an option to make the greenhouse models more financially viable?
Great question. Yeah, that would have been a nice thing to include actually in this presentation, because that's absolutely the case that we have greenhouse projects in very, very urban areas that are developed as a high rise, and we have greenhouse projects in very, very rural areas or suburban areas. So basically you're designing the homes to meet the neighborhood. You want the homes to fit into the neighborhood. And so obviously you're going to have a smaller site with those higher land costs in urban areas than the ability to have sprawling acreage in a more rural or suburban area.
All right. Have you worked with any adopters in South Carolina yet? If yes, where, and could we connect with them to tour their facilities? Unfortunately, not yet, and we are certainly eager and hoping. South Carolina is one of the states that we have not yet worked with. Do communities struggle with the universal worker aspect? I.e., does housekeeping get done, activities, and so forth? And let me just address that a little bit. I think the universal worker, a versatile worker, if you will, certainly can bring its challenges. I think my mantra is it's all about leadership. It's all about the level of support that a leader, that direct supervisor is providing. What have you done in terms of education to equip your self-managed work team to really understand their role, their expectations, and the associated responsibilities that they have? It really is all about how are you communicating information to ensure that they are set up for success. What are your systems like, and how are they ordering their food? How have they been, what kind of training have they received to really understand how to prepare meals consistently and of a decent quality day in and day out? So, there's incredible variability, and, what we have really determined is that it's a real function of leadership, that level of an empowered workforce and how you get there. And we will be in a subsequent webinar, our next webinar on May 3, we're actually going to delve more deeply into the workforce challenge. And we've got 3 executive leaders who are going to speak to their experiences. So that's a webinar that you won't want to miss. And I think, you can't have jump. You have to really go all in and fully commit to what this model is really asking you to do. You will gain efficiency through the self-managed work team that is adequately supported and resourced and held accountable to doing their job well. Because that's what will impact your turnover. When Terri was talking about staffing and the associated costs with turnover, that's where you're going to realize some of the return on that investment. And this team that deeply knows consistent staffing, where they deeply know elders and they're able to control, for example, their food costs and the medical costs and so forth, that's where you're going to gain some of your efficiency. Okay, let's see. In the greenhouse model, do you hire full-time maintenance and housekeeping people?
That's going to depend on the size of the project. So we suggest projecting the FTEs for housekeeping and maintenance based on the number of beds. And we have formulas actually that we've developed based on research at existing greenhouse homes that can help projects in being able to, to project those numbers. But yeah, no, we typically, oftentimes you may have a part-time housekeeper, or not a full-time housekeeper. But again, it depends on the size of the project.
All right. And are there any mixed housing high-rise models that include low-income housing on some floors and greenhouse homes on others?
I am not aware of that. Are you, Susan?
Not yet, no. No, I think, we've certainly entertained conversations. I think there are people that are thinking about this, and, we would love to take that to the drawing board, if you will, to the financial feasibility model tool to be able to see how something like that would pencil. And I think what I like about the tool is that Terri's able to kind of contemplate what the greenhouse specific part of the project could look like, not just by itself, but as a part of the bigger picture.
Yeah, just kind of to follow up with that, oftentimes projects that we work with include other product types on the same campus. So a developer or an organization may be looking to develop greenhouse homes in addition to perhaps some independent living or some assisted living. And so we can help them in modeling, showing the greenhouse homes in relation to those other product types. So you're really able to understand how each are functioning from a financial standpoint.
Well, Terri, thank you. You have been a wealth of information, and for those of you, if your question didn't get answered, you can certainly reach out to us, and we will have more offline conversations. I wanted to remind you that Rachel will be sending out a link to the recording of this session, as well as the PDF of the presentation that you saw. And just to let you know, if you happen to live in the western part of the country, we invite you to attend one of our 2 upcoming workshops. Next week, there is a workshop in Loveland, Colorado on April 18, and on May 31st in Portland, Oregon. I love the workshop because it offers participants kind of that seeing is believing, where you're able to actually get into a greenhouse home. You're able to talk to the elders, to the staff that work there, and really try to understand it from actually feeling it and getting inside. Additionally, I've referenced our next webinar, which is on May 3rd at 1 o'clock Eastern. And once again, this is kind of the next part in our workforce webinar series. And it's taking executives from 3 open greenhouse homes, and they're going to share some of their lessons learned and what are those critical factors for success in ensuring that what have we learned from recruitment, what have we learned from retention, and what are we doing to really enable and empower a workforce and create jobs that really are meaningful to those that work there. So I thank you again for joining our call, and we look forward to seeing you either at a workshop or on a webinar coming up. Thanks very much and have a great day.